Right, we'll go ahead and get started. Thank you for joining our media availability. We'll have District Health Officer Kevin Dick on the call today to discuss some important public health matters going on in Carson City at the legislature, and also an update as usual on COVID-19, RSV, and flu. So Kevin, if you are ready, please unmute and go ahead.
Yes, thank you, Scott, and I want to thank everybody for being here today. I'd like to begin with a legislative update. It's been a busy week, or it will be, for public health this week down at the legislature. And I want to start with some context on why that's so important. Funding for public health in Nevada has been ranked among the lowest in the country for quite some time. In fact, we're tied for last in the nation. And while I'm proud of our efforts to respond to the COVID-19 emergency, there were many areas in which proper or even average funding for public health would have made our community better prepared, as well as our health district. Our staffing levels are well below what is needed. Our data collection and reporting systems are out of date, and our ability to take on the many public health needs in our community is restricted due to lack of funding and how these funds have to be spent. Much of the funding that we receive is what's called categorical. It has to be spent only for specific services, and it doesn't have the flexibility we need to address the true needs of our community. So this funding is important not just for addressing pandemics and communicable disease emergencies, but for foundational public health services, for what we need day in and day out in our community to help protect the health of our citizens and residents, and to help improve their health outcomes over their lifetimes. So earlier this week on Monday, I had the opportunity to present, along with other public health authorities, a briefing on public health in Nevada for the Assembly Health and Human Services Committee. And tomorrow I will be in Carson City for introduction of a bill, Senate Bill 118, that would establish and fund a public health improvement fund. Our lack of adequate public health capacity, staffing, and infrastructure was harshly revealed during the pandemic. This funding, which would be roughly $5 per capita, would allow health districts and the state to be in a better position to address public health needs in an equitable and transparent way. This would go a long way in making sure our staffing keeps up with what we need as far as national averages, and our systems are able to efficiently tackle pressing needs. You probably remember in the early days of the pandemic that I was being asked, and Scott was, for data on how the disease was impacting our communities, what populations were being affected, what was happening in the Hispanic community and the Black community, where were cases of diseases occurring. At that point, we were operating off an Excel spreadsheet. We really need funding to help develop more and better data platforms and more dashboards like the ones that we've been able to develop through the COVID-19 response, to provide better information for us to have that information and for the community. With the funding under the public health funds, our staffing would be flexible, and our staff could be dedicated to the areas that our community needs those investment, rather than mandated through the categorical funding that we receive now under federal grants, or with the very limited funding that we receive from the state. So we think there's a lot of benefit for the public health funding to address the many needs that we have in our community. And we hope to see the bill passed and signed by the governor. As far as the COVID-19 update, our 7-day moving average of new cases is at 37.4, and that's been pretty steady over the last couple of weeks, but it's about 12 cases higher per day than the numbers that we saw during January. We started January at about these levels. We went down to about 23 cases or so through the month, and now we're coming back up to that roughly 37 new cases per day. Our wastewater sampling is showing that we're also seeing some increase in the COVID-19 concentrations based on samples that were collected through February 5th. So that correlates with what we're seeing with an increase in the number of cases. However, on the bright side, these are still fairly low levels of cases and of wastewater compared to some of the historical surges that we've seen. So COVID is still significantly present in the community that we're seeing through this, and we expect to continue to see some variations occurring as we move forward. We're also, with the Nevada State Public Health Lab, looking at variants that are occurring in our community. And the latest samples from early February show that the BQ1 and BQ1.1 continue to be our dominant strains, and they make up over 50% of the 110 samples that the lab genomically sequenced. The next most detected variant is the XBB lineage, which made up 17% of the total samples that were sequenced. The XBB is the most dominant variant in the US, but in Washoe County, it's still the BQ variants that dominate. So this is kind of consistent with the pattern that we've seen where we're kind of slower and behind the rest of the country as we see these variants show up in Washoe County. The hospitalizations, the Hospital Association reported 28 COVID hospitalizations in Washoe County. That number was in the teens at times last month. So we're also seeing some uptick occurring in those hospitalized cases for COVID-19. Our COVID vaccine team will be at the Spanish Springs Library today from 3 to 5 if you need a COVID-19 bivalent booster. And the team administered 16 vaccines at the Accept Black History Month celebration last Saturday. We want to thank Accept and Pastor Gwen Taylor for hosting the event and their continued efforts to help underserved individuals and families with public health resources. For RSV, our cases continue to decrease. We were down to 27 RSV cases that were reported last week. This is the lowest number of reported cases in a week since the second week of October. And we're now, I think, have RSV levels that are well within historical norms for us following a very large early season surge of RSV. For flu, our flu levels remain steady, and our influenza-like activity also is fairly low. Overall, seasonal flu activity continues to decline across the country. So we're in a pretty good place at this point with RSV and flu, but our flu season is not over. And given that we have this continuing cold weather, I still am highly recommending that people be vaccinated for flu, as well as to be up to date on COVID-19 boosters. Any pharmacy in town should have the flu vaccine and COVID vaccine widely available. And you can also call us at 328-2402 if you want to schedule to be vaccinated here. So that's the end of my remarks. I'll turn it back over to you, Scott, if there are any questions.
Thanks, Kevin. Any questions for Kevin from media?
Hi, can you guys hear me?
Yes.
This is Siobhan. I just have a quick question, and this is just spurred off. My pediatrician said that this to me recently, that if you had kids in school like last year, likely you had COVID. Do you have any kind of estimate on how many people haven't had COVID since the beginning? Is there any kind of, is it possible that you haven't ever had COVID at this point?
Well, let me take that last one first, Siobhan. Yes, it is possible that some people have never had COVID, but most people have had COVID. I can't tell you off the top of my head the percentage, but there have been some studies done that have found that the vast majority of the population has had COVID and has developed the antibodies showing that they were at some point infected with COVID-19, or they have been immunized to have those antibodies. So the numbers that people with the antibodies And the number that have actually had the disease are believed to be in the majority, but we can try to dig out some of those figures for you.
And this is a health question about you. Since you're the health director, it seems weird to ask this because it's a health question. So have you, as the health director, avoided COVID this whole time?
You know, I did pretty well. I did pretty well for quite a while, Siobhan. But I actually contracted COVID at the end of July last year. And fortunately, I had an extremely mild case because I had kept up with my booster shots. But I did test positive. I had a sore throat for a day, and I was congested for a few days. But I never even really developed a fever thanks to the vaccine and the protection that it provided for me. But I think most of us, as far as our circle of friends and families, most of the people that we know have had COVID at some point since the beginning of the pandemic.
Do you know anyone personally who you're sure hasn't had COVID? And is there anything to glean or learn from that type of person?
Well, I don't know that I can say for sure that I know that of nobody that is anybody that for sure has not had COVID, because I think I'd need to have an antibody test from them to know that. But I can tell you I have an 87-year-old father who has not contracted COVID to our knowledge. But he's also been very cautious, recognizing his risk factors and from his age. He stayed up to date with his boosters, but he still gets the curbside delivery or curbside pickup for groceries, and will wear a mask anytime he's indoor in a public place.
And with the antibodies test, though, would it catch it if you took a test now? If you had it a year ago, how long would the antibodies test tell you if you never had it?
I am not an expert on that, Siobhan, so we could do some follow-up, but I would say, and perhaps Dr. Dow can help us, but I believe that it should probably show up if you've had COVID, some antibody. But I don't know, Dr. Dow, if you're able to respond to that.
Hi, so for antibodies, it would show up even say a year out. It would you will be able to pick some up.
And is there anything to learn from people who never had it? Is there something like, since we're still learning so much about COVID, are there some people who might have just been like immune to it, or that's not possible?
That's a really difficult question to answer, because just by looking at the number of cases that's being captured, there's obviously one, there's cases that's not being reported, and two, some people could just had asymptomatic cases. Like Kevin said, it's really hard for us to just judge by sheer number. It could only be an estimate based on if you're testing for antibodies that's in the community. And but for me, around me, that my friends who either had very mild cases or people who probably was asymptomatic but did not report having COVID, they are definitely very, very careful with their layer protection, as in they always wear a mask, stayed away from a lot of social circles, and definitely was vaccinated and kept up to date with her vaccination. And this is the same with every respiratory disease. Not that you just have a strong immunity yourself, your age also matters, and your own immunity also matters, but also you are taking a lot of precautions in the layer pattern.
Do you think it's like my pediatrician said, like if you were in public school, chances are you had it? Is that accurate? If you were a kid in school, and I know kids had such mild cases, because when I was talking to my pediatrician, I was like, I'm sure we never had any symptoms, but he was like, if you had a kid in public school, they probably had it. They just never had symptoms.
The reason that your pediatrician would say this is likely stemming from the fact that because you're in a school setting, that transmission level is pretty high. We usually see when school season starts or when university has back to schools, we see, increase in cases. That's because that interaction cannot be avoided. Kids are sitting close to each other. They interact with each other in different classrooms, in activities. And when you cannot avoid that level of interactions, a lot of diseases get transmitted, not just COVID. We see norovirus, we see other respiratory diseases that gets transmitted between children.
So chances
it has
are,
to do,
like the odds are, if you had a kid in public school, your kid probably was exposed to it, just never had symptoms.
I think the chances are much higher than if you were not in a socially compact setting. For me to give you an actual number, that's actually a little.
The odds are that your kid probably had it or was exposed to it. The odds
I would say that's likely. Yes.
Okay. Thanks. Do you know where you got COVID, Kevin?
Actually,
in July?
I had been at a conference and I had been traveling, so my exposure was increased during that time period. Yeah.
Do you still wear a mask on a plane? Will you wear a mask on a plane if you travel this summer?
Yeah, I would wear a mask if I was in an airport setting or a plane.
Thank you.
And Kevin, we've got a question in the chat from Carly. It says, any other legislative priorities other than SB 118 or any other bills the health district is following?
Well, we're following a number of bills. The SB 118 is the major legislative priority that we have this session and that our District Board of Health has identified as a priority. So that's really the most important bill for us, is to finally see some increase in the state funding for public health, recognizing how important public health is for all of us in our lives and for our economy. There's another bill. I'm sorry, I don't have the bill number off the top of my head. That's being heard on Thursday afternoon as well. And that's the bill from the Washoe County Regional Behavioral Health Policy Board. And that one is in regards to the need for us to have more behavioral health providers and to provide for student loan forgiveness for the providers that would be graduating out of Nevada institutions.
Carly said, thank you. Are there any other questions for Kevin or anyone else on here? Okay, we'll wrap it up. Thank you all for being here. It's being recorded. We'll put it on the COVID-19 washoe.com website. If you want a copy of the raw file, just send me an email and I'll get that to you. Thanks, Kevin. Thanks, Nancy. Thank you, everyone.
Thank you all.